Hi, thank you so much for joining us. We are broadcasting live from our Herma Heart Center. My name is Corey. I work on the social media team, and today we have a very interesting conversation lined up for you. I am joined by Dr. Goot. He is one of our cardiologists, and we're going to talk about how three-dimensional imaging works, and we're going to talk about how our Herma Heart Center is able to use this technology to provide some of the best outcomes for our patients. And we want to hear from you, so please go ahead and post your questions in the comments section of this video, and we'll try to answer as many of those as we can throughout our broadcast. So with that, let's just jump right into it. Dr. Goot, could you begin with by describing your role in our Herma Heart Center?
Sure. Thanks for the introduction. I'm a pediatric cardiologist, so in addition to caring for children with heart defects on an inpatient and outpatient basis, I'm also further specialized in cardiac imaging. So I do general echocardiography, cardiac MRI, as well as three-dimensional echocardiography.
And so for those who might not know, what do we mean when we say cardiac imaging or an echocardiogram? What does that actually mean?
So an echocardiogram is simply an ultrasound of the heart.
Okay.
And when we say cardiac imaging in general, it's a specialty within cardiology that includes echocardiography, cardiac MRI, CT, so all different types of modalities of taking pictures of the heart. And
why is it so important for us to get the best image of the heart? What are we looking for?
So that's a good question. As a cardiologist, in assessing a patient, it's really important to get a good clinical understanding of the patient, but I think also of importance is understanding our patient's anatomy, and in some cases very complex anatomy. And so having really optimal imaging helps us make the best choices in caring for our patients.
And so technically, how does it work? How are we able to look inside a child's body and see a heart? What is going on here?
So for the example of an echocardiogram, what we use is it's ultrasound like any other ultrasound. We use sound waves to generate a moving picture of the heart.
Okay.
And we can use other parts of ultrasound, including something called Doppler, where we can measure gradients, so narrowing across valves. We can assess how much of a valve leaks. We can look for defects in the heart, so a number of different things.
And I'm familiar with going to a movie and seeing a 3D movie, right? But we're talking about three-dimensional imaging of the heart. I mean, talk about the advancements that three-dimensional imaging provides versus two-dimensional imaging and what that means for the work you do.
Sure. So a three-dimensional picture, I wish it was like the movie where you had to put on special glasses to see it, but what we're really doing is taking advantage of two-dimensional principles and using different colors to provide depth to a picture.
Okay.
But in a three-dimensional echo, it's different than two-dimensional echo in that as opposed to a single plane or a single view of some part of the heart, we're able to encompass pretty much the entire structure of interest, as well as the structures around it, and look at it, and then see it in a moving fashion so that you can see things in great detail without having to sort of conceptualize it. You have it right in front of you to look at.
And are there certain heart conditions or heart defects that you typically would see or find benefit in going through a 3D imaging?
Yeah, so specifically valve lesions,
Okay.
in particular lesions of the mitral and tricuspid valve, also the aortic valve, are three targets that we have for three-dimensional echo. And usually we use this as a complementary modality in the preoperative assessment of these defects. So when we're looking at surgical planning for certain patients, if they're going to undergo repair of their valve, we use this as a modality to provide sort of the additional blueprint, so to speak, for the surgeon.
So when our surgeons are preparing to do a complex heart surgery, repair of a valve, the benefit they gain from this 3D imaging is helping them create the treatment plan or get a better sense of what this heart looks like before they actually do the operation?
Exactly. So for a surgeon, when they're operating on a valve and they're looking at the valve's not moving because it's in surgery. And so this provides a moving concept of it, so we can identify areas of disease or areas of leak, areas of concern, so that they have a plan going into the procedure.
And so what is on the screen over here? Is this a 3D image?
So, yeah, this is an example of three-dimensional echo. So this is an image looking at several valves in a patient's heart. You can see that, again, it is still on a flat screen and it's not coming out at you, but we utilize the different colors to understand the depth of it and see, again, valves in moving motion, so you can see different parts of it or areas of abnormality.
So when I look at that I don't see much. Now, but you've probably gone through some pretty extensive training to have the qualifications to do this. Can you talk a little bit about your background and the training you've received?
Sure. So most of us within cardiology look to advanced training elsewhere. And so for my specialty, I actually chose to go to a program that did high volume three-dimensional echo because there's really not a lot of places in the world to get training in doing this. So I actually ended up going abroad for a year where I received training in not only 3D echo, but cardiac MRI and general echo as well.
And now, when I look at the patients that we see at Children's Hospital of Wisconsin, it could be like a 2-month-old, right, or a 17-year-old. Does your approach change based on the age of the child, or does our team's approach change?
In terms of the imaging, yeah, it does, and specifically speaking for three-dimensional echo, one of the caveats to it is what it's really doing, it's collecting a chunk of data, and it's basically taking multiple two-dimensional echo pictures and putting them together over multiple heartbeats. And so in order to do that and get a good picture, the heart has to be still in motion, meaning the patient can't be breathing, because when you breathe, your heart moves up and down. And so putting it back together is challenged by breathing. And so ideally, for our patients, the more cooperative they can be with holding their breath, the better. Now, that doesn't totally limit us, because for younger patients, there's other strategies for taking the pictures, other methods I can use, and we also occasionally will use sedation if we have to. So provide light sedation for a patient to be sleepy in order to get pictures without them moving a lot or taking big breaths.
So kind of paint the picture for me. Is this invasive in any way, or is it harmful, or does it hurt?
Definitely doesn't hurt. So it's no different than a regular echo in terms of how the patient feels, other than the breath holding part of it. We put warm gel on the chest, and then using an ultrasound probe, which looks just like this, we take pictures. So it's definitely non-invasive, non-painful, using sound waves, which are not harmful to people, and then all they have to do is be able to lie still.
Then how quickly are you able to see the results of your work?
So I see them as I acquire the pictures, but what I often do is we'll sit down and for a short period of time go through the pictures. And one of the advantages of three-dimensional echo, kind of like I mentioned before, is it's better than 2D in that we get a whole chunk of data, and so I can look at that from any angle that I want and create pictures that way to show the surgeons or the other cardiologists.
Now, what sort of team comes together to provide this experience, right? When somebody comes to our Herma Heart Center for this, you're not the only person they see, is that correct? Correct.
So I work with the other cardiologists who may or may not have patients that they're referring for this type of procedure. I also work with our surgeons and our surgical team and get referrals straight from them, sometimes for preoperative planning for patients. We also have sonographers, we have nurses, we have a large team here in the imaging department that kind of all come together to make these types of imaging happen for patients.
It's really interesting. Different question. What do you love most about your job?
Oh, I think the patients. I think that's an easy answer. I do this because I love working with kids, and I love working with patients and people and families. I think that's what motivates a lot of us to continue to do what we do.
And for those families who may be watching this at home, are the services provided at the Herma Heart Center unique? Is this a unique service?
I think it is. Again, I had to go through a lot of training to do this, and there's a number of us here that have gone through training in our own individual niche, so to speak. So yes, I think we absolutely provide a unique experience here, both our surgical team and our cardiology team, as well as all of our other staff. I think we do a fantastic job here.
Well, Dr. Guth, thank you so much. I really appreciated learning more about 3D imaging of the heart. And for those of you who want to learn more, please visit our website. Just go to chw.org/heart. Thank you all for joining us.